As you may know by now, the use of opioids is epidemic, killing over 90 Americans each day. Our next guest, board-certified oral and maxillofacial surgeon, Dr. B.D. Tyner, joins us via satellite to discuss why it's important for patients and caregivers to explore non-opioid pain management options. Good morning, doctor. And I do understand that with students out of school soon, many will opt to have their wisdom teeth removed, and for some, that's their first opiate experience.
Well, thanks for having me, Linda. You're absolutely right. In 80% of the cases in young adults, wisdom tooth removal is the first exposure they have to opioids. And surveys have shown that in 70 to 80% of the cases, those patients, if given a choice, would opt to have some way of managing their pain that does not involve having to take opioids. And
the good news is, even in your practice, you don't have to take opioids. There is new medication out there that doesn't give you this trouble and is very, very effective.
There is, and in my practice for the last 9 months, a new drug has been introduced to the oral surgery market called Exparel. And Exparel is a drug similar to Novocaine, and I'm sure everyone out there has had their jaw numbed at some point in time to have a filling done by their dentist. Exparel is similar to that. It's injected into the surgical sites at the end of the surgical procedure while the patient's still under sedation. And unlike Novocaine, which wears off in a few hours, this drug provides long-term pain relief in the postoperative period from their wisdom tooth surgery.
Doctor, since so many other different types of doctors use Exparel already, why do you think it's taken this long to get the dentists to start using this?
Well, as oral surgeons, we've been using it in the hospital setting for 2 to 3 years now. But it was packaged in a smaller vial and introduced to the oral surgery market, so it's more applicable now for office setting for procedures such as wisdom tooth removal.
And so really the patient needs to talk to their oral surgeon about alternative pain management options so we can have this conversation about Exparel.
Yes, I would encourage parents and patients when they go in for their preoperative consultation appointment to just have a frank discussion with their surgeon about pain, how to manage that pain, and what options are available to you to manage that pain without having to take opioids. We have that option today.
And I understand this Exparel is very effective, and you can actually use it right after the surgery, and it lasts for a couple of days?
That's correct. And it's been in my experience in our practice that the patients who've opted for the Exparel, about 50% of those have not taken any opioids after surgery. They only take Motrin or Aleve or Advil. And the other 50% of the Exparel patients have only taken 2 to 3 opioids for breakthrough pain, as opposed to the patients who don't use Exparel, they end up taking as many as 20 opioids to manage their post-surgical pain.
Well, I am sure for the people who are watching today who have kids and grandkids who are going to be looking at that surgery come summertime, they're going to be happy to know that there are great alternatives, especially this Exparel for oral surgery if they're going to go ahead and have their wisdom teeth out. We want to thank Dr. Tyner this morning, and our viewers can log on to oralsurgeryprep.com for more information about alternatives to opiate medication.